Ingleside is a system of 3 life plan communities in the DC metropolitan area. Before CRISP, we were given access to portals of different hospitals. Using CRISP means that each user has their own username and password, which gives them access to all hospitals that are participating in CRISP.
We have our skilled nursing unit up on our 7th floor, and when a resident is out on skilled or in the hospital, our social worker follows up with the discharge planners as soon as we get a notification that that resident is in the hospital. And that immediately triggers the transitioning back to our skilled nursing center. We have the ability to know when that resident is registered in the ER, when they transition to an inpatient status, and we can start counting down the 3 days inpatient status days, and then be able to start working with our team to know what resources do we need to provide the type of care that that resident needs at our community.
CRISP has been really beneficial for me overseeing independent living residents because I'm able to see if they get registered into an emergency room and even if they get admitted. So from there I can then coordinate with our social worker, contact people in our health services departments, and prepare if a resident needs to come here from the hospital.
With the portal, we have the ability to pull diagnostic testings and results. We can also pull medication lists. That is very beneficial because it helps us be able to identify the key resources that a resident would need if they were coming back to our skilled nursing.
About 40% of our residents we're finding are entering hospitals because of a fall. So this type of reports would be helpful for us to be able to provide better services, maybe to understand why they're falling, and to see if there's ways we can prevent these falls in the future.
When we get the encounter notifications, we have our chaplain who then goes out to the hospitals to visit the residents. It's always nice when a resident has a guest from the community who comes in hand, with flowers in hand. That is one of the ways that we provide platinum service.
Our residents don't necessarily move through the continuum of care. They want to age in place, and we would like to be able to provide care in their home settings. We have been very happy with using the data that we can share in CRISP.